Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
With healthcare complexity and workforce challenges increasing across the board, there's opportunity for pharmacies to take on new roles to improve patient care. Dr. Jill Michaud, System Director of Pharmacy at Aspirus Health, joins us to share their innovative approach to expanding pharmacy services. I'm Gretchen Brummel, Pharmacy Executive Director in the Vizient Center for Pharmacy Practice Excellence, and your program host. We're recording live at the 2023 Vizient Connection Summit. Welcome to the podcast, Jill.
Thanks for having me. I'm excited to be here.
Tell me a little bit about Aspirus and your role there.
Aspirus Health is in north central Wisconsin as well as the Upper Peninsula of Michigan. And we're a 17-hospital system, with many of those being small rural critical access hospitals, as well as our flagship hospital in Wausau, Wisconsin, which is a level 2 trauma center, tertiary care center, and where our patients get transferred. So we look to have innovative practices at our Wausau Hospital site.
Well, I'm really looking forward to hearing a little bit more about that. And you've been at Aspirus for a number of years, is that correct?
I've been there over 25 years now. And when I started at Aspirus, it was just Wausau Hospital, a single community hospital. Since then, we have grown and continue to grow. And as that growth has occurred, my role has expanded from local director of pharmacy, regional, and now system.
Well, congratulations on that progression in your career. That's great to hear that. I know your pharmacy staff have taken on some additional activities as well, some things outside of traditional pharmacy, and some things that have been historically physician-driven tasks. Tell me a little bit about those activities that your staff is doing.
One of the most interesting is our role in insulin management. I looked at the dates, and it was back in 2008. One of our endocrinologists was retiring. And as you know, specialties in rural areas are hard to come by. So they're looking for who would partner with them to handle the easy patients. Surgeons don't really want to manage insulin for their inpatients. So looking for someone to provide that coverage and quality of care. Our clinical coordinator worked with endocrinology and set up a protocol so physicians could order insulin management per pharmacy, and the pharmacist would take it from there. One of the best parts, and one part that makes it unique, is we offer the service 24/7. It's not just single pharmacists working on the day shift, but we expect and train all our pharmacists to be able to manage the insulin and glycemic management for their patients.
Well, that's fantastic. So your pharmacists have been actively managing all the insulin dosing for all of your patients for 15 years at Aspirus Health, is what you're saying.
The exception would be our medical residents manage their own patients, because the likelihood of them ending up in a facility where pharmacy is managing that is low. So they have to be trained to be able to do it themselves.
Sure. Yeah. It's important to have that training aspect so that when they move on to other rural settings, they know how to manage their patients as well. Do you have any sense of data before and after the pharmacist took this over in terms of outcomes or patient satisfaction or employee satisfaction?
A few years ago, we were part of a collaborative looking at hypoglycemic rates, and our rates were consistently lower than the benchmark. So that was good to see. We do track hyperglycemic events as well as average glucose readings. CMS is coming out with a new standard, so we're excited to be able to compare ourselves nationwide, looking at the work that we've done at Aspirus.
That'll be exciting to hear how you do in those metrics, because we know pharmacists are the pharmacotherapy experts, and so it's important to have them steering the ship when it comes to those types of activities. I know you've also done some work in the oncology space, is that right?
Yes, oncology is another area where if I could hire 3 more oncologists today, I would. We partnered with our oncologists and established a collaborative practice agreement where the physician will initiate an oral therapy and the pharmacist takes it from there. For example, physician will say, please start this patient on Xeloda. Pharmacist will meet with that patient, go through the side effects, and establish a dose and write the prescription so that it's in package sizes that a pharmacy can even fill. So there will be less phone calls back and forth, work with the prior authorization, and in general, ease that comfort level for a patient. With our infusion patients, we see them every 6 weeks or every 4 weeks. But with the oral oncology meds, they're just as risky and just as important, and there wasn't that established touch point. So with the pharmacist meeting with those patients, they have that touch point. And of course, the patients love having someone they can talk to and reassure them and share experiences with.
Going back to that patient satisfaction and patient experience, that really sounds like a win-win to have the pharmacist involved early so that the prescription can be set up so that it is in the appropriate packaging. You're not having to do another phone call or send a fax to clarify all those things that you and I know all too well. And the other piece that I can see that being an advantage to is something you mentioned earlier, which is it's hard to recruit specialists to rural areas. So if we can have pharmacists doing some of these types of activities, that takes some of the burden off of those oncologists as well.
Exactly. I would like my pharmacists to think of themselves as extenders for the physicians, using their expertise to lighten the caseload of the physicians so that all our patients have a higher level of care.
Great approach. Another thing I've been really impressed with at Aspirus Health is your approach to public relations and marketing activities with regards to your pharmacy. How did you decide to make this a priority, and what has your approach been to this? I know I've seen some things with your residents. Tell me a little more about it.
Our residency program, we have an ASHP accredited DGY1. We are in our 25th year, and we wanted to find a way to promote our residency program more to a broader audience. We took that to marketing, and they're like, well, we're not quite sure if what you're thinking would work. We're thinking too small, a Facebook page, a website, something. And they're like, how would you like to do a media presentation once a month on a pharmacy topic? Right. Sure, absolutely. Initially, we looked for topics, and there's an infinite number of topics, as you know. So we have done drug take-back events, how to swallow a pill, OTCs, and then also expanded to some roles of the pharmacy and pharmacist where we're able to highlight the oncologist pharmacists. So that is fun to see it post on Facebook. And then the local media also likes it. It's well done, and they can just pick it up and add it. It is fun for our residents. Their grandma and grandpas love to see them on TV or shared on Facebook. And it's something that has helped us with our residents and make them ready for when we get the media requests. Can you talk about the COVID vaccine? Can you talk about this? That they've had some experience with that.
That's so important because pharmacists are a trusted healthcare professional. So to get them that training in media relations and marketing early in their career is incredibly important and gives them a good foundation for when they're out on their own. Do you include that in your residency recruitment to let them know that this is something that's coming for them, or is it more of a surprise when they get there?
We do include it now, and it also lets us send a link to potential recruits and say, look what you could be involved with, and it helps also build their CV. Presentations.
Wonderful. I've been very impressed with that program, and I hope you keep it up and expand it moving forward. So what advice do you have for other pharmacies who may be faced with challenges that we talked about earlier, folks coming to them, asking them to do things that are outside of the typical pharmacy scope of practice?
The key is to say yes, and here are the resources I need to be successful. And there are a lot of reasons to say no. You might not feel comfortable with it. You might not feel you have the staff or the expertise, but saying yes, and I need these resources to help me. So originally with the insulin management, endocrinology was very grateful to partner with us, at letting their workload, and having a physician partner to advance helps as well with the C-suite when you're asking for additional resources. In addition, we've been able to show an ROI of having pharmacists who are already there working manage these insulin or oncology meds and at a lower cost than another provider. Also is getting IT buy-in so that your EHR is set up. And then one plus and minus is doing a pilot. I love pilots because you can work on all the kinks, you can see what worked, what didn't work. But when you do a pilot of a service to a physician, they never want a pilot to end. So my advice is to be very clear in your start and stop dates and that it's a pilot, and then they can help bring the pilot to a full service.
I really love how you describe that, and you've summarized what is a personal mantra of mine, which is yes, if. Yes, we can do that if. You're saying yes, we can do that if you provide these resources, or if it's for this finite amount of time, or if we have IT support for this period of time. That's great advice for our listeners when we're asked to do things that are maybe outside of the scope of pharmacy practice. And congratulations for all the great work that's been done at Aspirus Health and for your leadership there as well, and wishing you the best in the future there. Jill, thank you so much for joining us here today to share your thoughts and insights. It's been wonderful chatting with you.
I've enjoyed it as well. Thank you.
Please join us for more Verified RX podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. Verified RX is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.